Most people don't think about their circulation until something goes wrong, until the numbness starts, until the swelling doesn't go down, until the legs feel heavy every single evening, and they just assume that's what getting older feels like. I need you to hear this clearly. That feeling is not normal aging. That feeling is your body asking for help. And today, I'm going to show you exactly how to answer it, starting with what you put on your plate. My name is Dr. Miles Parker. And while most of my work centers on what disease does to the body, I spend an enormous amount of time thinking about the opposite question. What does the body need to protect itself? What does it need to keep its systems running cleanly, efficiently, and without interference? Circulation is one of those systems that most people take entirely for granted until the day they can't. The blood moving through your legs and feet right now is carrying oxygen, nutrients, and immune cells to some of the furthest tissue from your heart. It's doing that job against gravity through miles of capillaries across a network of vessels that can either stay flexible and open or slowly narrow and stiffen depending on one major variable: what you eat. Today I'm giving you 12 foods, not supplements, not prescriptions, not anything you need a specialist to approve. 12 foods you can find at any grocery store that have real, documented, mechanistic effects on vascular health, nitric oxide production, and blood viscosity. Let's get into it. The first food is beetroot. If there is one food I would put above everything else on this list for raw circulatory impact, it's this one. Beetroot is one of the richest dietary sources of inorganic nitrates found in nature. When you consume it, those nitrates are converted by bacteria in your mouth and enzymes in your bloodstream into nitric oxide, a molecule that signals the smooth muscle lining your blood vessels to relax and dilate. When your vessels dilate, resistance drops, blood flows more freely, and the pressure required to push circulation all the way down to your feet decreases significantly. A study published in the Journal of Applied Physiology found that beetroot juice supplementation improved blood flow to the lower limbs and reduced peripheral vascular resistance in older adults within just a few hours of consumption. You don't need a supplement. Half a cup of roasted beets 3 to 4 times a week, or a small glass of pure beetroot juice does the same job. Start there. The second food is fatty fish: salmon, mackerel, sardines, herring. The omega-3 fatty acids in these fish, specifically EPA and DHA, work on circulation through multiple pathways simultaneously. They reduce the stickiness of platelets, making the blood less prone to forming the small clots that can partially obstruct flow in peripheral vessels. They reduce triglyceride levels, which at high concentrations thicken the blood and slow its movement through smaller capillaries. And they reduce the systemic inflammation that causes arterial walls to stiffen over time. Research from the American Heart Association has consistently found that 2 to 3 servings of fatty fish per week is associated with significantly improved endothelial function, which is the health of the cells lining every blood vessel in your body. Endothelial function is essentially the health score of your circulatory system. Protect it. The third food is dark leafy greens, specifically spinach, arugula, and Swiss chard. Like beetroot, these are exceptionally high in dietary nitrates, but they bring something additional to the table. They are loaded with magnesium, a mineral that plays a direct role in maintaining vascular tone. Magnesium deficiency, which is extraordinarily common in adults over 50, is directly associated with arterial spasm, increased vascular resistance, and elevated blood pressure. When your magnesium levels are adequate, your blood vessels are more responsive to the signals telling them to stay open. A study published in the European Journal of Clinical Nutrition found that higher dietary magnesium intake was independently associated with better peripheral circulation and lower incidence of peripheral artery disease. Add a handful of spinach or arugula to at least one meal every single day. It takes no effort and the return is significant. The fourth food is pomegranate. This one surprises people. Pomegranate contains extraordinarily high concentrations of polyphenols, particularly punicalagins and ellagic acid, which are among the most potent antioxidants found in any food. Their specific action on circulation involves the preservation of nitric oxide. Here's why that matters. Nitric oxide, that vasodilating molecule we discussed with beetroot, is fragile. Free radicals in the bloodstream destroy it before it can do its job. Pomegranate's antioxidants neutralize those free radicals, essentially protecting and extending the life of the nitric oxide your body is already producing. Research from the Clinical Nutrition Journal found that daily pomegranate juice consumption over 12 weeks significantly increased blood flow through the carotid arteries and reduced arterial stiffness. The legs benefit from the same mechanism. A small glass of pure pomegranate juice or half a fresh pomegranate daily is enough to move the needle. The fifth food is ginger. Fresh ginger root has been used in traditional medicine for thousands of years, but the science behind why it helps circulation is specific and well documented. Ginger contains compounds called gingerols and shogaols that directly inhibit platelet aggregation, which is the clumping together of blood cells that increases viscosity and slows flow through smaller vessels in the extremities. It also has a mild warming effect on peripheral circulation by stimulating blood flow to the skin and underlying tissues. A study published in Prostaglandins, leukotrienes, and essential fatty acids found ginger to be as effective as aspirin at inhibiting platelet clumping through the thromboxane pathway without aspirin's side effects on the stomach lining. Fresh ginger grated into warm water every morning is one of the simplest and most underrated circulatory habits you can build. The sixth food is garlic, raw garlic specifically. Garlic contains a compound called allicin, which is produced when garlic is crushed or chopped and the enzyme allinase is activated. Allicin has a direct, relaxing effect on the smooth muscle of blood vessel walls, similar in mechanism to the action of nitric oxide. It also reduces the activity of an enzyme called angiotensin-converting enzyme, the same enzyme that blood pressure medications called ACE inhibitors target. Garlic essentially does a version of what those medications do, naturally and without a prescription. Research from the Journal of Nutrition found that aged garlic extracts significantly improved circulation in the lower extremities and reduced ankle brachial index measurements in patients with mild to moderate peripheral artery disease. Let crushed garlic sit for 10 minutes before cooking to maximize allicin content. That 10-minute wait is one of the most worthwhile habits in your kitchen. The seventh food is walnuts. While most nuts offer some cardiovascular benefit, walnuts are in a category of their own for circulation, specifically because they are one of the few plant foods with a meaningful content of ALA, the plant-based omega-3 fatty acid. More uniquely, walnuts are rich in L-arginine, an amino acid that serves as the direct precursor to nitric oxide production in the endothelial cells lining your blood vessels. Without adequate L-arginine, your body cannot produce enough nitric oxide, regardless of how many beets you eat. Research published in the Journal of Nutrition found that walnut consumption improved endothelial function and reduced vascular inflammation markers in adults with cardiovascular risk factors. A small handful, roughly an ounce, every day is the target, not as a snack to fill hunger, but as a deliberate daily investment in your vessel health. The eighth food is turmeric. The active compound in turmeric, curcumin, has been studied extensively for its anti-inflammatory properties, but its specific effects on circulation are often underreported. Curcumin improves the function of the endothelium, reduces oxidative stress in arterial walls, and has been shown to inhibit the formation of fibrin, a protein involved in blood clot formation that can partially obstruct flow in peripheral vessels. A study published in Nutrition Research found that curcumin supplementation over 8 weeks significantly improved flow-mediated dilation, which is a direct measurement of how well your blood vessels expand in response to increased blood flow demand. Critically, curcumin is poorly absorbed on its own. Combine it with black pepper, which contains piperine, and absorption increases by up to 2,000%, according to research in Planta Medica. Cook with turmeric and always add black pepper alongside it. That combination is non-negotiable for getting the benefit. The ninth food is citrus. Oranges, grapefruits, lemons. Citrus fruits are exceptional sources of vitamin C and flavonoids, particularly hesperidin and naringenin. Hesperidin has a specific action on capillary strength and permeability, essentially reinforcing the walls of the smallest blood vessels in your extremities and reducing the fluid leakage that causes the swelling and heaviness in legs and feet that so many people experience. Research published in the European Journal of Clinical Nutrition found that daily hesperidin consumption improved microvascular blood flow and reduced symptoms of chronic venous insufficiency in just 4 weeks. Naringenin, concentrated in grapefruit, additionally inhibits an enzyme involved in the breakdown of nitric oxide, further supporting vessel dilation. 1 to 2 pieces of whole citrus daily is enough. The whole fruit delivers significantly more hesperidin than juice because much of it concentrates in the pith. The 10th food is cayenne pepper. This one works through a mechanism that is almost immediately noticeable if you pay attention to how your body responds after eating it. Cayenne contains capsaicin, a compound that stimulates the release of substance P and activates TRPV1 receptors in blood vessel walls, triggering vasodilation and increased peripheral blood flow. In simpler terms, it physically opens up circulation in the extremities. The warmth you feel in your feet after eating something spicy is not coincidence. That is increased blood flow arriving at tissue that may have been relatively underperfused. Research from the journal Cell Metabolism found that capsaicin consumption was associated with improved blood flow to peripheral tissues and reduced arterial stiffness over time with regular use. Add a pinch to your meals daily. You do not need a large amount for the effect to be real. The 11th food is dark chocolate, specifically varieties with 70% cacao or higher. Dark chocolate is rich in flavonols, a class of antioxidant that has a particularly direct and well-studied effect on nitric oxide synthesis in the endothelium. Research published in the Journal of the American College of Cardiology found that dark chocolate consumption increased flow-mediated dilation by up to 10% in healthy adults and improved peripheral circulation within 2 hours of consumption. The key word is dark. Milk chocolate has too much sugar and too little flavonol content to produce any meaningful vascular effect. 2 small squares of 70% or higher dark chocolate daily is the studied effective dose. It is not a reward. Treat it as a functional food and consume it with that intention. The 12th food is green tea. Green tea contains a catechin called EGCG, epigallocatechin gallate, which is one of the most well-studied compounds in nutritional science for its effects on vascular health. EGCG activates nitric oxide synthase, the enzyme responsible for producing nitric oxide in blood vessel walls, and simultaneously inhibits endothelin-1, a compound your body produces that causes blood vessels to constrict. The result is a dual action, more vasodilation and less vasoconstriction, happening simultaneously with every cup. Research published in the American Journal of Clinical Nutrition found that regular green tea consumption was associated with a 28% lower risk of peripheral artery disease in older adults. 2 to 3 cups daily is enough to produce a measurable effect. Brew it properly, 2 to 3 minutes at water just below boiling, to preserve the catechin content that would otherwise degrade at higher temperatures. Here's what I want you to take away from everything we've covered today. Your circulation is not fixed. It is not a permanent condition you inherited and cannot change. The walls of your blood vessels respond to what you feed them. They can stiffen or stay flexible. They can narrow or remain open. They can be chronically inflamed or relatively calm. And the primary input driving which direction they go is food. Not medication, not supplements, not medical procedures. Food. What you eat every single day is either slowly closing those vessels or actively keeping them open. You don't need all 12 of these foods tomorrow. Pick 2, beetroot and garlic, ginger and dark leafy greens, walnuts and green tea. Start there, be consistent for 3 weeks, and pay attention to how your legs feel. The body responds faster than most people expect when you give it what it actually needs. Share this with someone who complains about heavy legs, cold feet, or swelling that won't go away. They may not know that the answer is already available at their grocery store. I'm Dr. Miles Parker. I'll see you in the next one.